Nysa Therapy Incorporated presents Healing Personality Disorders. Course number 2, Nysa Techniques. Lesson number 4, Parting Out.
It is ethically and clinically appropriate to seek supervision or consultation before using any new technique in your practice of psychotherapy. Please contact us at nysatherapy.com if you would like to receive guidance from our highly experienced consultants.
Here is Dr. Stephen Diggs, Nysa Therapy founder and director.
Hello everyone, and welcome to our next lesson of our basic techniques. Lesson number 4, Parting Out. Parting out is big. Parting out is the greatest shortcut to the change of the personality that I've ever discovered. And it was actually invented by my college friend Alan Hamilton back in the 90s when we were still attending school. And it's just continued to work because it gives you an immediate and powerful shortcut to changing the actual personality function. You can do it. Now, you don't change who the person actually is, because that's what we're trying to find. That's what we're trying to grow. What you change are the defensive structures, the defensive mechanisms that make up the personality as a disordered reality. The personality, when it's disordered, is made up of defense mechanisms that cause it to do things that don't work if you're going to live a free and spontaneous and enjoyable life. And we can get to those places with parting out. We can get to the places where things are corrupt and twisted and paradoxical and damaged. We can get to them rapidly, and through parting out, we can change them. So this is very, very important. As I like to do, you know me a little bit by now, I like 6 steps. So here are the 6 steps of parting out. The first step is to show that symptoms come from inner conflict. Personality symptoms don't come out of nowhere. They come from the conflict between different parts of the personality. Then, number 2, we separate those parts. They're engaged in conflict, they're engaged in war, in battle, and we separate them apart from each other. Then we ask the aggressive part, the defensive part, that is pushing down on the real self to keep it from activating, we ask it to say, what do you do or say to the real self in order to keep it pushed down? Then, number 4, we establish that the reason they do that is to protect. It's a very twisted idea, and we'll talk a lot more about it. Then, once we've determined that that defensive, aggressive part that is pushing down on the real self is doing it to protect, we esteem it for its protection. We thank it. We appreciate it. You've been protecting. Thank you. Then, number 6, at the end, we negotiate a release of its power over the real self so the real self can blossom and activate. Those are the 6 steps. So let's get to step 1, show that symptoms come from inner conflict. The first thing we want you to do is to listen to your patient's description of their symptoms and listen for inner conflict. So they're going to say things like, we've heard this many, many times, I beat myself up. I beat myself up. So there's an I and there's a myself, and the I is beating up the myself. That's inner conflict. Symptoms without inner conflict are something like, I'm depressed all day long. I just lay on the bed and don't do anything. That's depression. That's major depression, which is part of some personality disorders, but it in itself is not a sign of personality disorder from our definition because there's no conflict. But if they say, I sit on the couch all day long, I'm depressed, and I would really love to get up and go out and go water skiing because that's what I love to do. Oh, now we've got conflict because part of you wants to water ski and part of you wants to lay on the couch, and the part of you that wants to lay on the couch is blocking the part of you that wants to water ski. That's inner conflict. That's dynamic conflict on the inside. So, you're going to listen for it, and then you're going to develop an explanation in your own mind right now. You're not going to say it yet, but you're going to think to yourself, the symptoms are caused by one part of the personality acting defensively upon the real self to stop activation. And you're going to develop that explanation. You're going to develop an explanation that includes the parts, the real self, the critical parent, the hurt child, the betrayer. These are the parts that involved, and you're going to develop an explanation in your own mind for that. Then, once you've got that explanation, you're going to tell the patient what your explanation is using your fist to demonstrate. So, the reason we use the fists is because the right brain, which is what we're trying to get to, remember, that's the unconscious. It used to be called the unconscious, now we call it the right brain. That's where the sense of self resides. That's where attachment resides. That's where things get broken and entangled emotionally. And it's mostly nonverbal. So we're going to explain things with words, but we want to show it to the right brain because the right brain is spatial and relational. Spatial and relational. So when we use our fists and we talk, we're talking to both the left brain and the right brain at the same time. So fists are important. So we use our fists to demonstrate, and we say, I believe that one part of you is pushing down on the other part, and the part that's pushing down on you is using depression to keep you from water skiing, because that's what you'd like to do. So I believe that's what happens. There's a pushing down. Or one part of you is telling you you're a loser and no one will ever love you. And that keeps you from going online and trying to date. And you'd like to go online and date, but that keeps you from doing that. Or one part of you wants to be very healthy and live a healthy life, but the other part is forcing you to binge and purge and take you to the bathroom at work to purge, and you don't want to do that, but you can't stop it. So there's these two parts, and we're showing these parts in conflict, right? This. Then we say, does that make sense? Does that feel true? If they say yes, then we want to continue. So, I've mentioned this before, but I want to dig in a little deeper, and that is that we all have this kind of internal dialogue, how we talk to ourselves, you know, and sometimes that's more negative, we say negative things to ourselves, sometimes it's more positive, we say positive things to ourselves. So I'm wondering about your dialogue today. Is it negative or positive? What's it like?
Oh, it's negative.
Okay, I'm sorry. So, can you tell me the things that you're saying to yourself right now?
I just feel like I'm a loser. I tell myself I'm just ridiculous and lazy.
Yeah, okay. Yeah, I'm very sorry that you're going through this, but I want to try and fix it. Now, tell me if this makes sense to you, Sarah. Does it make sense that there are actually two parts inside of you, and one part is kind of mean and aggressive, and the other part is sort of small and has low self-esteem, and the mean part sort of is the one that says the mean things to the other part?
Yeah.
Okay.
Yeah, it's just like that.
Okay, good. Now, Nysa Therapy works with the dynamics of the personality, and all that word dynamic means is when different parts affect other parts of anything. Anything that's dynamic has several parts that affect each other. That's all we're talking about when we use the word dynamic. And in Nysa Therapy, we are looking for very specific dynamics in which there is a defensive action in which one part affects another part to affect it. In particular and precisely, a defensive part of the personality attacks the real self to keep it from activating because it thinks that's dangerous. But in order to do the work that we're about to do to actually change that, we have to help the patient realize that there are multiple parts within them that are acting on each other. Now, I have almost never had a patient tell me that they didn't think it made sense that there were two parts of them acting on each other. All people with personality disorder know there are parts that are attacking each other. They know they're not a single person. It's just common knowledge. And I've done this many thousands of times, this exercise we're about to do. So people know they're split in two, talk to them about it, and they'll say, yes, that's what it's like. Step 2, we want to separate the parts. Holding the fists together, then pulling them apart, you say, let's imagine the two parts are separating out from their conflict. Let's imagine that together. And at this point, I might say, you know, this is all pretend. We're just using the imagination to get some power over the personality. And that's because the personality is made up of dynamics created by the early childhood imagination. So when we use imagination, we're using the very medium, the very manner in which the personality disorder was formed in the first place. Then we say, find a place in the room for the real self to go, but we usually call it by its name. In this case, we're doing a role play with Sarah, so we'd say, find a place in the room for Sarah to go, or find a place in the room for the part that wants to water ski to go, or find a place in the room for the part that wants to be healthy, right? And send it there. So we're going to ask the patient to send it there. Then we say, all that's left in you now is the part that was blocking or stopping or attacking the real self. That's all that's left in your body. That's all that's left in your personality is that one part. Next we say, I'm going to talk to the part of you that stops the real self. So please close your eyes, and when you open them, you will speak only from the point of view of the blocking part, the stopping part, the attacking part, that part that won't let the real self activate. Now, if patients resist and they think they can't do it, we say, it's only pretend, we're only imagining. I'll help you. Almost everyone can do it. But then we have to really help them. And that means saying, okay, just pretend. I know that Sarah isn't over there, but let's just both pretend she is. And let's just pretend that you're this mean part, this blocking part, this attacking part. Let's just act like it, just pretend, and I'll talk to you. And before long, almost everyone can get to this place. This exercise has only failed a handful of times in a lot of years. Now, when the defending part opens its eyes, be warm and welcoming. This is very important. That defending part is mean, aggressive, attacking. And when someone comes into therapy, they often say, oh yeah, I'm really hard on myself, I beat myself up, and I just tell myself horrible things. And it can be easy to try and say, well, don't listen to that part, or just stand up to that part and tell us no. These are common things that people are often told in therapy. That doesn't work. Take it from me, that doesn't work. What works is befriending that part, seeing that part for the value it brings to the personality. If you try and put that part down, send it away, attack it, put it down, you're going to fail. That part has been active in the personality for a long time. So instead, be warm and welcoming. Hi, thanks for talking to me. It's good to see you here. I really want to help Sarah, so I've got a lot of questions I want to ask you. And I appreciate you just showing up and appreciate the help that you're giving me right now. Then, once that welcome has happened, you begin questioning it in a certain way that I'm going to teach you in order to change the defensive personality. Okay, so what I'd like to do is I'd like us to think and imagine that these two parts are at war with each other. They're in battle, right? And the mean part is attacking the small part, and the small part's trying to fight back and survive, right? I'd like us to imagine that these two parts are separating out from each other, okay? And that the small, weaker part with low self-esteem is going to sit in that chair over there, okay? So we're just going to pretend, this is all pretend, none of this is real. We're just using our imaginations, right, to help do this. So that weak, small part of you is going over to that chair, and that means that what's left behind is that mean, aggressive part of you, okay? And so what I'd like you to do is to close your eyes for a minute, and I'd like you to imagine that you're allowing that mean, aggressive part of you to take over your brain, your eyes, your ears, your mouth, your hands, all the things you need to have a conversation with me. You're letting it take over, right? And now, once that mean part is the one in charge and is ready to have a discussion with me, I'd like you to open your eyes and we'll start having a talk. Hello. Is that right to call you the mean part of Sarah?
Yes.
That's a good name for you?
I hate her.
Okay, okay. What do you hate about her?
She ruins my life.
Tell me about that. What does she do?
She's a loser.
Mm-hmm.
She's ridiculous.
Mm-hmm.
She's got a boyfriend, Jerry. He's a bum.
Mm-hmm.
She's not worth anything.
Okay. You really hate her, don't you?
Yes.
Okay. And you sound very angry at her.
She does nothing right.
Yes, yes. Nothing, she does nothing right. Fails at everything, yeah?
Yes.
Yes.
She's not worth the oxygen that she
Yeah.
breathes.
Yes. Very good, very good. So this you've been with her a long time with this kind of problem.
Oh,
right?
yeah.
Yes. Okay. Thank you for telling me how you feel. This is really helpful.
I'm sick of her.
Yeah, this is really helpful. Thank you. Now, if this seems dramatic, it's not. This is what happens almost every time. Almost every time when we actually make that split work to our advantage, we find that personality disordered people have split personalities. One side is weak, one side is strong, and the strong side is attacking and mean. Over and over again we see this. And it is simply this easy to get the mean side present. Because what happens in the daily life of the personality disordered person is they walk around usually with the weaker side of them showing, right? Showing, but behind is that mean side beating up on them. And then when they get home and they're talking to their kid, then they'll switch into that mean part, and that mean part will say, you gotta get this homework done, clean up your room, this is a bunch of shit, nah, 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 nah. Then we'll see that switch. And then somebody comes to the door, they're back to that weak, soft part to try and survive. So there's this switch in the external world, but there's also that internal battle. What we're doing is we're taking advantage of that switch by making it happen in the therapy room. So now what we have is we've separated these two parts, and I am now talking to the defensive part of the personality that keeps the real Sarah, who is weak and small, which is what she was in childhood, over in the corner, beaten down, so she cannot activate. But now I'm talking to the source of the defense, and I can start making a case that the defense is no longer necessary. Step 3, ask, what do you do or say to the real self? Or what do you do or say to Sarah? Or what do you do or say to the part of you that wants to water ski? Right. So, when we ask the defensive part, the attacking part, to talk about what it says, we're doing two things. The first thing we're doing is revealing the interaction pattern of the defensive personality. It is not that person that makes up the defensive personality. It is not the self that's getting attacked that makes up the defensive personality. It is the way they act towards each other that makes up the defensive personality. The interaction patterns are the thing. People don't have anger problems. They have problems when their anger interacts with other parts of their personality to dominate it, or put it down, or to hide. It's about the interaction that happens. Right? So that's what we're trying to reveal. Next, we're trying to find a language that makes sense to that attacking part, that critical parent, that we can negotiate with, that we can talk about. You say this, you say this, you say this. We're later on going to ask, why do you say that? Why do you do this thing? Why do you take them to the bathroom and make them purge? What do you suppose your purpose is? But we have to know what they do. We have to know what they say. This gives us the substance we're going to work with. Step 4, we want to establish that the motive for the defensive behavior, the attack, the control, is protective. Now, if you think about it, when we say that this action is defensive, we're pretty much saying that it's protective. If you have defense mechanisms, no matter how ugly and painful they are on you, the fact that we call them defense mechanisms tells us that they're protecting something, they're defending something, right? So it shouldn't be hard to imagine that no matter how hard this person is on themselves, that motive is protective. So we ask, what do you suppose your motive, your purpose, your reason is for saying these things? What are you trying to accomplish? If the part, the critical parent, struggles to find its motive, help it out. It is gaining self-awareness, and that can be difficult. For a part that's been frozen in developmental arrest for a long, long time, it can be difficult to find that. So help it out. Look for aggressive statements that imply protection. So for example, if the critical parent says, I tell her she's stupid, so she won't talk to anybody, say, okay, why don't you want her to talk to anybody? Well, every time she talks to somebody, she just makes a fool of herself. Okay, and do you not want her to make a fool of herself? Well, of course I don't. Why don't you want her to make a fool of herself? Because it just makes her feel bad. Oh, so when you tell her she's stupid, you're actually trying to keep her from feeling bad. Could that be true? Wow, I never thought about it that way, but I guess that's true. So, it seems to me you're trying to protect him. I guess you're right. Now that I think about it, I guess you're right. And this is a difficult moment for many defensive protecting parts because they've never reflected on themselves before. They've never reflected on their motivation. They've never taken time to wonder because they're still regressed, they're still infantile, and they haven't developed that ability for self-reflection. So we're going to help them do it. We're going to hand it directly to them. Okay, you've been very helpful. I'm really glad to talk to you and hear what your point of view is like. So you're helping me a lot right now, so I appreciate it. But now my next question. What do you suppose is your reason for saying these things to Sarah? What's your purpose? What's your motive? What do you suppose you're trying to accomplish by saying these things to her?
She's just a loser.
Right?
Nothing she does right is...
Right? Right. But you say she's a loser. Saying that once is all you really need to say it to her. Say, you're a loser. You've told her. Why do you keep saying it? What's your purpose in saying it over and over again?
I don't even want her to live anymore. I'm sick of her.
Right? And do you think by saying these things to her, you will kill her?
I hope so.
Okay. Do you want to kill her or do you want to kill this body?
Her.
Okay. You want to kill her. And how long have you been trying to kill her?
Oh, a long time.
Okay. And what is your reason or your purpose for wanting to kill her?
Life is just too painful.
Life is too painful. For you or for her or for both of you?
Both of us. It's so hard.
Okay. And if you kill her, how will your life be less painful?
I just don't want to be bereaving anymore. It's too hard.
Okay. And if you kill her, how will her life be better?
She won't have to be in this world.
Yes.
It's the world.
Yes. It's a horrible world, isn't it?
It's hard.
Yes. And she has been brutalized in her life.
Oh, yeah.
Yes. Yes. And so you know how hard this world is and you know how hurt she's been.
Oh, yeah.
Yeah.
Oh, yeah.
Yeah.
All the time she's being put down.
Yes.
If not by me, her mother, other people.
Yes. Just, yeah. You know what I want to say to you is that I think that the reason you say these things to her is to protect her.
She's hurt.
But I think you say them to her so that she won't have to feel the pain of this world anymore.
She needs to stay home.
Is this why you say it? So
Yeah.
she'll stay home and not feel this pain?
No one could hurt her.
And if she dies, no one could hurt her, right?
Yeah.
Right. I think you are a good person trying to help her.
It's hard.
Yes. Do you think I'm right? You're a good person trying to help her?
I'm a good person.
And you're trying to help her, aren't you?
Yeah.
Yes.
I just don't want her to hurt anymore.
Exactly. Exactly. You don't want her to hurt anymore.
It's just so hard.
Yes, it is. So, you're trying to protect her because you're a good person. And that's a whole nother story than we thought we were going to hear when we started. Everyone's saying you're the mean one, you're the bad one. But you're not, are you?
No, oh, no.
No. Now, this is actually a very common discussion with people who have avoidant personality because their critical parent is this mean and aggressive and so hard and so willing to put the person down. But now we've heard what they say once we take the time to talk to them. They put them down so they won't get hurt anymore. They put them down so they won't try anymore, so they'll give up, so they'll stay in their house, and ultimately, so they'll kill themselves, because if they are dead, no one can hurt them anymore. This is what our patients' critical parents say when we take the time to talk to them. And it's a very touching moment when this part of the personality gets to be told that the reason they do things is to help, is to protect, that they are good people, but they're caught in a very difficult predicament in which they're attacking in order to protect. And once we've shown that to them, it can make it a lot easier to try and change this inner dynamic very directly and very rapidly by going right to the source of the conflict, the critical parent. Now, as I was saying earlier, all the parts get love, esteem, all the parts get empathy, all the parts get to feel cared for. Step 5 is we're going to esteem the defensive part for the protection it is providing, no matter how ugly that protection is. And we'll say, is it okay if I appreciate you for protecting her? If yes, then say, I truly believe you have saved her from pain. Thank you. But we'll go on a lot. We'll say, she was just a little kid. She didn't have adult intelligence or maturity or resources to protect herself in any way. And so you showed up and you figured out that if you tell her to shut up, she won't talk to anyone, and if she doesn't talk to anyone, she won't get hurt. You figured that out even though you had an infantile mind. So how can I not appreciate you? Because I truly believe many times in her life when you told her to shut up, you saved her from getting additional pain. I believe that. If they say, no, I don't want your appreciation, respect the decision. That's number 1 in our book. We let that person direct their own therapy. So you do not appreciate the protection. You don't say, I respect you, I thank you, I appreciate you. But you state that you do have those feelings inside of you and that you will not share them. But you don't give them the impression that you don't have positive feelings about them. And that can be an easier way for people to consume esteem. So, Sarah, I would like to appreciate you and thank you a little bit if I can.
That's weird.
Yes, very weird. But is it okay?
It's weird, but I guess it's okay.
Okay, thank you. I want to thank you and appreciate you for protecting Sarah. You and I both know her home life was horrible. And what happens in her family is still horrible. They still are horrible to her. We know that. And here she is, a little girl with no way to protect herself. And she's got a little girl's mind. She doesn't have adult intelligence. She's got a little girl's emotions. She doesn't have maturity. She doesn't have friends. She doesn't have allies. She doesn't have people who can understand. All she knows is she's getting hurt and abused every day. And there's no way to find a way to protect herself. She's just hanging out there. And then she invents you. All she ever knew was criticism. All she ever knew was attack. That's what was in her. That's what was in her mind and her imagination. And somehow she said, I'm going to use what I know to protect me. And she asked you and created you to attack her over and over again so she would remain small and little and not be exposed to all the hurt that was out there in her family. And you did it. Every time she wanted to be free and alive and show her family what a beautiful little girl she was, you said, shut up, sit down, don't go out there, you're a loser, you're ugly, you're stupid. And she collapsed. And so she didn't walk out into that living room and get hit again, get cursed at again, get shoved around, all the things that happened to her because you told her that. It was the only way available the two of you had to protect her. It was the only thing you had. Nothing else would have worked. And you did it. And I know this world pretty well. It's what I've spent my life learning. And I want to tell you what I believe is you protected her from many, many moments when she might have been further hurt by her family. You did that, and I want to thank you because you made her hurt smaller. And by the time she got to me, her spirit is still there. Her spirit is still intact. She still wants to live because you protected her. And I thank you and appreciate you for that.
That's weird.
Yes, it is.
Thank you.
You're welcome. It is weird because when you get down into the deepest structures of people with personality disorder, the basement of where they live, it's a weird place. People protect themselves by attacking themselves. Strange, paradoxical, but true. This is how it happens. And if you ask anybody with a substantial personality disorder, they'll tell you, yep, this is how it happens. It's weird in here. I do weird things and I don't know why, but we know why. It's for protection. It's for care. Now, we want to appreciate this part of the personality because in a few moments we're going to ask it to change. And we want it to feel like we're on its side and we're not against it. But there's another reason that we appreciate it and thank it, and that's because it deserves this. It deserves to be treated well. These parts of the personality are always treated like monsters and horrible things. They're not. They're simply doing the job they were given, and that's to protect this person in a horrible environment that they're growing up in. So I always feel happy when I get to look this part of the personality in the eye and say, thank you for what you did. Thank you for taking care of this little kid. I feel like something right is happening, like something has come full circle. Our final step, negotiate a release of power. Now, this part of the personality has had power over the real self. And that power is a defensive power designed to protect, but the real self cannot activate and grow to its full capabilities without the release of that power by the protective part. So, we're going to ask this question, and this is a terrific question. It took me about 15 years to figure this question out, so I'm kind of proud of it. If you're only trying to protect this person, why does he consider you a problem? Bam, there it is. You're right. I'm only trying to protect them. You, the therapist, just esteemed me. I'm the critical parent now for protecting him. We know I'm doing it. We know that this is a good thing, so why does he consider me a problem? And the answer is always the same. Well, because I treat him really badly. And that gives us a chance to say this. You are an obsolete protector. Yes, we appreciate you for what you've done, but your methods no longer work because they were developed when you were a little kid. They're obsolete. It makes no sense anymore to be treating this adult person who wants to live their life and be activated to treat them like a little kid. Say, you're stupid, you're ugly, shut up, don't go out the room, you know? That's no good. So we get back to the childhood, we start referencing the childhood, and we ask them, when did you start protecting this person? And we'll say, when you started protecting her, you were both small girls. Have you noticed she's an adult, but you're still a child? And one more moment of self-awareness hits this part of the personality, this critical parent. One more moment comes upon them and they go, oh my God, I've been attacking, but that's to protect. People appreciate me for doing this, but the protection I'm doing doesn't work anymore because she wants to live her real life. And the reason I keep doing it is because I haven't even noticed that she's an adult. I still see us both in my mind's eye as children. And then that awareness really brings it home that, oh yes, this person is ready to live their life. And sometimes I have to tell you, it'll be hard for the critical parent to accept that. And they'll say, no, she still needs me. You don't understand. You don't get this. And I'll say, okay, do this for me. Tell me about the body you're in. The critical parent will go, well, what do you want to know? Well, is it the body of a young girl or is it the body of an adult woman? Oh, it's the body of a grown-up woman. Okay, well, who fits that body better? This body right now that you're in, who fits it better? You or her? Oh, it's her because she's the grown-up and I'm still a child. Yes, it fits her better, doesn't it? So sometimes we have to get that far down into it. Then you'll say, I believe she can live and protect herself better without your protection. At this point, given who she is, the adult she is, the fact that your protection is designed to protect a little girl and she's ready to live her life, I believe she can live better and even protect herself better without your form of protection. Could that be true? If the answer is yes, we ask, could this be the time to start changing your relationship? So this part of the personality has come to really have their eyes opened about who they are, what they've been doing, and really the futility of continuing to do something that was designed to protect a small child. And so this invitation almost always gets the answer yes. Now, if the answer is yes, we ask them, do you have an idea of how you would like to change? And usually they don't. This is not something they've ever thought of. So we give them examples, which we've seen, again, thousands of times, of what you can do. The first thing you can do is just be silent and not say or do anything to this self. The second thing you can do is you can start making positive statements. Now, there's some very tenacious critical parents, protectors, who will insist, nope, she can't live without me, she can't do it, she's too unstable, she just can't do it, and no matter how you work with them, they're just not going to give up. So you say, well, how about if you start saying positive things instead of negative things? And surprisingly, they like that idea most of the time. They still feel like they want to protect, but they are willing to make positive statements. By far and away, the option most defensive parts select is retirement. And we have a funny way we do it, in which we say, okay, you're going to retire. Congratulations on your retirement. You must be really tired. And they are tired. They've been doing this job for a long time. It takes so much energy to run this much defense. And that is why personality disordered people are tired a lot and don't do much as their potential would grant them. So you say, well, where do you want to go? You want to go to the beach? You want to go to the mountains? You want to sit in a hot tub somewhere? And we kind of make it a playful thing about where they would go to retire. And then a lot, surprisingly, just say, well, I think I'll pass on. And that means dying. And we simply say, well, everything that exists passes on eventually, and we help them to let go and to dissolve back into the universe. So this is something that's actually very poignant and in many ways very beautiful when this part starts to really let go of the control and domination that they've been exhibiting for all these years. If the answer is no, I'm not ready to change, the real self still needs me to protect it. Then we ask, what is your end game? And they say, what does that mean? And we say, okay, well, do you plan on protecting her this way until the day she dies? And again, they're not reflective parts, they're action parts. And they go, well, I never thought about that. Yeah, so right now, you've basically got her locked up in her apartment, going to work, coming back, watching TV. And even though she would love to date and have friends and be active, that's what you've got her doing. Do you want to just do that until the day she dies? And they'll kind of go, God, I hadn't thought about that. Well, I'm asking you to think about it now. What's your end game here? And surprisingly, we can often get them to admit, no, I've got to figure out how to give this up because I do want her to have a life someday. I care about her. So that's one answer there. Sometimes they say, yes, that is my end game. And then we do a funny little thing where we say, well, I've got to tell you, if you want someone to just sit in their room and never have friends, never have a partner, never do anything, or some critical parents want this person to die, they lead them to suicide attempts frequently, or you want them dead, I think you must be the real patient here. I want to talk about how you were damaged in childhood, and we simply make them the patient. And that surprisingly goes well also. We may also ask if they don't want to change, aren't you tired from doing this? I'm exhausted. Well, wouldn't it be nice if you got to rest and they got to live their life, right? We assist that protecting part to change. And then we ask the real self to come back to the body. And we discuss the experience of being free from the defense. And this is also a lovely moment in which the patient has been, in our imagination, separated away, but in a very experiential, phenomenological way, there is that experience. It's going on. And now this oppressive, critical parent part, which has been controlling it in whatever form, is now gone. And they come back into this body and they feel like, wow, something's better. I feel lighter, we hear a lot. And very soon after that, the week after a parting out, there can be a lot of exceptions because in some cases, the first time, this real self is getting a chance to activate with no resistance from the critical parent. It's a lovely moment. We like it a lot. Thank you so much. You're doing so great here. I really appreciate how you're helping us out, okay? So now my next question. We've made it pretty clear you're just trying to help her, right?
Yeah.
You're trying to protect her. So my question is, if you're just trying to help her and protect her, why does she now consider you a problem?
Because I'm mean?
Yeah? That's what I think. What do you think?
Yeah. I think I hurt her a lot.
Yes,
But I'm just trying to protect her.
I agree. And so I think what we've got here is a situation in which when she was little, the only way to protect her was to attack her. But now she's not little anymore. And so that old method of protecting her isn't working very well for her.
Yeah.
Right? So your intentions are good. Your reasons for doing it are very good. You want to protect. It's just that your methods are very old and obsolete, really. Could that be true?
Yeah, I think that's true. I think she's moved on and I'm just stuck in the past.
Yes, exactly. She's moved on and you're stuck in the past. How old do you think you and she were when you started protecting her this way?
Probably around 5.
Okay. And when you think of her, how old do you think she is when she comes to your mind?
She's 5.
She's right. She's 5, right?
Yeah.
And how old do you think you are when you think about you?
I'm 5.
Right. Right. And so now we've got you acting like she's 5, but actually this body that you're in is the body of a grown-up woman, isn't it?
Mm.
Yeah. So one of the things that I'm showing you is a principle that Freud discovered when he was first working 100 years ago, and that is that the parts that get damaged and get developmentally arrested are stuck in the past and they do not progress. And so this critical parent, this protector, is stuck in the past and is not progressing. It's not her fault. She had to be there. She had to be there to protect. And now that protection is breaking down because she thinks Sarah is 5, and she thinks she is 5, and she thinks she needs to operate like they are 5. She didn't progress. She didn't learn through life. This is not her fault. But what we're doing is we're bringing to her self-awareness because Sarah has lived her life, the real self, damaged, broken down, beaten, but actually becoming self-aware of what's going on inside of her and miserable about it. This part of the personality is just acting and acting and acting, but never stop to take a minute and say, why do I do this? Who am I? Where did I come from? How old am I? So we're bringing self-awareness to this part of the personality. And when we bring self-awareness to this part, all of a sudden the world makes sense today, not years ago, but today. And that's when we can do what I'm about to do next, and that is to ask it to change. So, since I've been talking to Sarah, I'm pretty convinced that she is feeling ready to live her life without your protection and that she believes that she can probably do it and do a pretty good job of it.
Yeah, I can see that.
What do you think of that idea? How does it feel to think about her living her life without your protection?
I can move on.
Can you? Thank you. Thank you. I feel a lot of respect for you right now, because you care about her so much that you protected her when she was little, and then you never gave up your job of protecting her. You never stopped. And now that we're helping you to understand the situation the way it is today, the current situation, your generosity for her, your care for her is coming out again, and you're saying, I can move on. So I just appreciate you so much today.
You're welcome.
Okay. Do you know how you'd like to move on? I know how parts like you typically move on, and I can...
I don't know.
Okay. Well, I'll tell you some possibilities that people do, okay?
Okay.
So parts like you, they move on sometimes by just being silent and not saying anything anymore to the self, right? Sometimes they decide to say positive things. They say encouraging things. Sometimes they decide to retire, in which they just go someplace and rest. You're probably very tired.
Yes.
Yes. And sometimes they decide to pass away, because all things that exist eventually pass away, and you can decide that it's your time just to pass away. Any one of those would be just fine.
I think I'm just going to go and rest and let her live her own life.
Okay. Okay. So kind of retire and rest.
Yes.
Do you know where you want to go to retire? I mean, the beach, the mountains, the city? Where do you want to go?
The beach.
The beach? Okay.
Yeah.
Do you have a beach you like?
Hawaii.
Okay. Very good. So, if you're ready to retire, you ready?
I have a friend in Hawaii.
Okay, good. That's excellent. Excellent.
Yeah.
Okay. Good. So if you're ready, I'll help you to head off to your retirement.
Okay.
Okay. So just go ahead and close your eyes. And with all our thanks and appreciation for what you've done, you can feel happy and proud for what you've done. You're going to let go of all the connections you have to this body, to this life. And you're going to feel yourself drifting away towards Hawaii. And my words will get further and further away from you as you drift further and further towards the beach that you're going to rest on. You'll say one last goodbye to Sarah.
Oh, goodbye, Sarah.
And the next time you open your eyes, you will be Sarah and not this other part. Hey.
Hi.
Did you see all that? Did you watch all that?
Yeah.
What do you think?
I'm free.
You are free, aren't you?
Yeah.
How does it feel?
Feels good. I have those critical voices.
Living life without them.
Mm.
Were you surprised at how much she cares about you?
Oh, yeah.
Pretty twisted, huh?
Oh, yeah. Oh, definitely, definitely.
So what I want to tell you is that in my experience, she's gone. But your brain has been wired to carry a lot of negative thinking patterns, right?
Mm-hmm.
Because she's been saying negative things to you for so long. That's wired into your brain. So the brain changes more slowly than the personality changes. So you'll probably have some more negative thoughts along the way. But that doesn't mean she's come back. That means your brain is still in the process of changing. Okay, does that make sense?
Yeah. Mm-hmm.
So if and when you have negative thoughts, I want you to say, well, that's my brain changing and catching up. It's slower than my personality. So that's not really what's going on. And then just let that negative thought go away and move on to the other thoughts that you want to have.
Okay, I can do that.
Okay, very good. This might seem a little exaggerated or fairy tale, but it's not. I would say about half the time when we're dealing with a very harsh critical parent, it won't go away the first time that we do a parting out. It will keep coming back and keep coming back. But about half the time, it does go away. And it might show up 8 months later when she's starting to date a new person, but we'll part it out again and say, nope, she's doing fine here. Here's the reason why. And that part will say, okay. But shockingly, a lot of times that part is gone and the person starts getting well quite rapidly. So we want you to take an attitude of possibility here. Psychotherapy sometimes holds the attitude that it must take a long time to make remarkable things happen. And that's where our good friends in solution-focused and strategic therapy are so important to us, because they'll tell you, no, we can do remarkable things quickly. Now, when you do an exercise like this, most of the time we want to really focus the next week on exceptions. What got better after the parting out? What was better? Because the person does have built-in signals in their neurology, in their brains, that say, oh, this has got to happen. I've got to be hard on myself. And they might come in and say, oh, things are horrible, things are horrible. We say, okay, but after the parting out, after we did that, what else happened? And sometimes you just have to go, what did you do on Monday? What did you do on Tuesday? Just go through the calendar week, and all of a sudden these exceptions will start popping up. Because this dynamic of defensive oppression has happened and has been broken up, there will be exceptions. That real self is going to come alive in ways, but you may have to dig for them. And when you dig for them, it is very satisfying. So have an attitude of possibility and think about the possibility that this kind of change can and does happen rapidly. The Nysa parting out, it's just the foundation of what we do, because it says we know what personalities are about, we know how they go wrong, we know they're fighting with each other on the inside, there's an internal battle going on, an internal war going on, and we want to get in the middle of that war, tell everybody they're just trying to protect, and break up this battle and see rapid personality change. Now, this fundamental comes to us from a book by Donald Kalshed called The Inner World of Trauma, in which he describes this quite well and quite thoroughly. So if you want more on this, you can read this book. But it is an integrated technique. It integrates relational therapy, the esteem, the connection, the empathy. It integrates psychodrama, splitting off, going to a different chair, going to a different part. It integrates solution therapy, solution-focused therapy. We esteem you. We see the exception here. We see what you're doing. So thanks to Donald Kalshed, and thanks to the inventor of this lovely technique, Alan Hamilton. And thank you for completing another one of our courses.